Which of the following is not a principle of primary health care? A. Appropriate technology. B. Community participation. C. Equitable distribution. D. Provision of essential drugs. Primary health care is a very important question often asked in your exams. So what is the correct answer? See, the primary health care was defined by Alma Ata Declaration. There was another question on this Alma Ata in 1978, which laid out four important principles of primary health care. What are the four principles of primary health care? Appropriate technology definitely is needed, because the use of appropriate technology means use of oral rehydration salt is a appropriate technology. Example. B. Community participation is also a principle of primary health care, because without people participation it is not possible to achieve health for all. So B is also correct. C. Equitable distribution. So all the essential drugs, everything should be equitable distribution. See, the healthcare should reach all the people, either rich or poor. It should reach all the people. So equitable distribution is also correct. And what is wrong is provision of essential drugs. Even though it is critical, it is not a principle of primary health care. Instead, it is an application or a method to achieve the overall health goals. So what is the last one missing principle of primary health care?